What is diabetes mellitus? Diabetes mellitus refers to a group of metabolic disorder characterized by high blood sugar level over a prolonged period. This condition occurs due to either inadequate insulin production by the pancreas or the body's inability to properly use the insulin. Insulin is a hormone produced by the pancreas that regulates blood sugar level and helps glucose to enter the cells for the usage of the energy. There are three types of diabetes mellitus. The first one is this diabetes typically diagnosed in childhood or adolescence. This disease occurs when the immune system attacks and destroys insulin-producing cells in pancreas. This leads to little to no insulin production. The second type of diabetes is the most common type of diabetes. This diabetes often occurs in adulthood. In this type of diabetes, the body either doesn't produce enough insulin or become resistant to insulin. This causes elevated blood sugar level. The last one is the gestational diabetes. This type of diabetes develops during pregnancy in some women who haven't had diabetes before. It usually revolves after childbirth, but both the mother and child have increased risk of developing type 2 diabetes later in life.
The symptoms of diabetes mellitus can be vary depending on the type of diabetes and its severity. Here are the common symptoms. Firstly, frequent urination, polyuria. Increased urination occurs as the body tries to eliminate excess sugar through urine. Secondly, excessive thirst, polydipsia. Dehydration resulting from frequent urination leads to increased thirst. Third, unexplained weight loss. Despite normal or increased food intake, unexplained weight loss can occur due to the body's inability to use glucose for energy properly. Fourth, increased hunger, polyphagia. As cells are deprived of glucose, the body may signal increased hunger to compensate for the lack of energy. Fifth, fatigue. Fatigue is feeling tired or fatigued even when not engaged in physically demanding activities. Sixth, blurred vision. High blood sugar levels can affect the lenses in the eyes, leading to blurred vision or difficulty focusing. 7. Slow wound healing. Diabetes can affect circulation and impair the body's ability to heal wounds, leading to slow healing or frequent infections. 8. Numbness or tingling in extremities. Peripheral neuropathy can cause tingling, numbness, or pain in the hands and feet. Last but not least, recurrent infections. Individuals with diabetes may experience frequent urinary tract infections, skin infections, or yeast infections.
How does it occur in our body? Diabetes mellitus develops due to issues with insulin, a hormone produced by the pancreas. Here's how it occurs. Firstly, insulin production or function. In type 1 diabetes, the immune system attacks and destroys the insulin-producing beta cells in the pancreas. As a result, little to no insulin was produced. Second is insulin-resistant or reduced production. In type 2 diabetes, the body becomes resistant to the effect of insulin or doesn't produce enough insulin to maintain normal glucose level. This can be due to genetic factor, obesity, sedentary lifestyle, or any other factor that could lead to this disease. Next is glucose regulation disruption. Insulins help glucose from the food we eat entering the cells to be used for energy. When insulin function is impaired or absent, glucose accumulates in the bloodstream instead of being utilized by cells, which can cause high blood sugar level.
Next, effects of diabetes mellitus to our body. Certainly, diabetes mellitus, in a condition characterized by high blood sugar levels, affects the body in several ways. Firstly, cardiovascular system. High blood sugar can damage blood vessels, increasing the risk of heart disease, stroke, and circulation problems. Secondly, kidneys. Over time, diabetes can harm the kidneys, leading to diabetic nephropathy, which is kidney damage, and potentially kidney failure. Third, eyes. It can cause diabetic retinopathy, damaging blood vessels in the retina and potentially leading to vision loss or blindness. Fourth, nerves. Nerve damage, neuropathy, can occur, resulting in tingling, numbness, or pain in the extremities, and in severe cases, it may lead to problems with digestion, sexual function, and more. Last but not least, wound healing. High blood sugar levels can impair the body's ability to heal wounds, leading to slow healing and an increased risk of infections. Insulin replacement therapy is crucial for managing diabetes, especially in type 1 diabetes and some cases of type 2 diabetes where the body doesn't produce enough insulin or become resistant to it. Here's how it helps patients. First, regulating blood sugar. Insulin replacement therapy provides the body with the insulin it needs. It helps glucose from the bloodstream entering cells, regulating blood sugar levels, and preventing hyperglycemia, which is high blood sugar, which, if left uncontrolled, can lead to serious complications. Secondly, mimicking natural insulin. Insulin therapy mimics the body's natural insulin production, enabling cells to use glucose for energy. This helps prevent symptoms of diabetes such as excessive thirst, frequent urination, fatigue, and blurred vision. Third, preventing complications. Properly managed blood sugar levels through insulin therapy can significantly reduce the risk of long-term complications associated with diabetes, such as heart disease, kidney problems, nerve damage, and vision issues. Fourth, flexible treatment options. These are various types of insulin, which is rapid-acting, short-acting, intermediate-acting, and long-acting. And modes of administration, injections, and insulin pumps available. This allows for personalized treatment plans tailored to individual needs, lifestyle, and blood sugar control requirements. Fifth, improving quality of life. By effectively controlling blood sugar levels, insulin therapy helps patients lead more stable and healthier lives. It allows them to participate in daily activities without the fluctuations in energy levels and symptoms caused by uncontrolled diabetes. These are the interventions that could be taken towards kids and adolescents to prevent diabetes mellitus. Firstly, promoting healthy eating habits. Promoting healthy eating habits involves encouraging and adopting a balanced approach to food consumption that supports overall health and well-being. Here's how it can be explained. First, balanced diet. Encourage the consumption of a variety of nutrient-rich foods from all the food groups, which is fruits, vegetables, whole grains, lean proteins, and healthy fats. This provides essential vitamins, minerals, fiber, and other nutrients necessary for the body's function. Secondly, limit added sugars and processed foods. Encourage reducing the intake of foods high in added sugars, unhealthy fats, and excessive salt. Processed foods often contain hidden sugars and unhealthy additives, contributing to various health issues, including diabetes. Third, regular meals and snacks. Promote the habit of eating regular, balanced meals throughout the day. Snacking on nutritious options like fruits, nuts, or yogurt between meals can help maintain energy levels and prevent overeating during main meals. Last but not least, mindful eating. Encourage mindfulness during meals, focusing on eating slowly, enjoying food, and paying attention to hunger and fullness cues. Secondly, consequences of excessive sugar consumption also play a vital role in prevention. Excessive sugar consumption can have various negative consequences on health. Firstly, weight gain and obesity. Sugary foods and beverages are high in calories. Overconsumption can lead to weight gain and increase the risk of obesity, which is a significant risk factor for various health conditions. Second, increased risk of type 2 diabetes. High sugar intake can contribute to insulin resistance and impair the body's ability to regulate blood sugar levels, increasing the risk of developing type 2 diabetes. Third, dental issues. Sugar feeds bacteria in the mouth, leading to plaque formation, tooth decay, and cavities. Frequent consumption of sugary foods and drinks can erode tooth enamel and cause oral health problems. Lastly, affecting mental health. Some studies suggest a link between high sugar intake and an increased risk of depression, anxiety, and cognitive decline. Last but not least, interventions that could be taken towards kids and adolescents to prevent diabetes mellitus is incorporating nutrition education in schools, encouraging sports and active play. Incorporating nutrition education in schools and encouraging sports and physical activity play are essential components of promoting a healthy lifestyle among students. By providing nutrition education, schools can equip students with the knowledge and skills necessary to make informed choices about their diet and overall well-being. Nutrition education in schools typically involves teaching students about the importance of balanced diets, understanding food labels, and making healthy food choices. This education can be integrated into various subjects such as science, health, or home economics, ensuring that students receive comprehensive and consistent information about nutrition. Encouraging sports and physical activity play is equally important as it helps students develop physical fitness, motor skills, and teamwork. Schools can offer a range of sports activities, both competitive and non-competitive, to cater to different interests and abilities. Physical education classes can also be structured to include a variety of activities that promote cardiovascular endurance, strength, flexibility, and coordination. By incorporating nutrition education and promoting sports and physical activity play, schools can contribute to the overall well-being of students. These initiatives not only foster healthy habits but also instill lifelong skills that students can carry into adulthood. It is important for schools to collaborate with parents, teachers, and community organizations to create a supportive environment that reinforces healthy choices and encourages an active lifestyle.
Ways to prevent from getting diabetes mellitus. Preventing diabetes mellitus involves adopting healthy lifestyle habits to reduce the risk of developing the condition. Here are some effective preventive measures. Firstly, healthy diet. Focusing on a healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Second, regular exercises. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise weekly. Next is portion control. Be mindful of portion sizes to avoid overeating. Pay attention to serving sizes to maintain a healthy weight. Furthermore, adequate sleep. Prioritize getting enough quality sleep as poor sleep patterns can impact insulin sensitivity. And lastly is regular health check-ups. Schedule regular check-up with healthcare professionals to monitor blood sugar levels.